Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello again, it's Christopher Cunny, and welcome back to another episode of Straight Outta Healthcare IT. I'm so excited today to have an amazing woman and transformational leader in our industry, Miss Amy Brown. And Amy is here to share her journey in the healthcare arena and the exciting things she's doing with her new company. Let me just very quickly give you a high-level overview of Amy's background, but I'll let her really drill down in a little more detail about what she's been focused on. So Amy Brown is an executive with 20 years of public and private sector experience in healthcare, public relations, startup management, policy development, quality improvement, and insurance operations. Founder of Authentics, LLC, inventor of Notables, www.inspiredbybaby.com. Well, she's an amazing, again, technology thought leader. Some of her most recent positions were serving as Chief Operating Officer of Seven Corners Incorporated, also previously served as COO at Center First LLC, and Vice President of Government Programs for a Regional Health Plan, including strategic planning and overseeing day-to-day operations, business operations for Medicare and Medicaid and other government contracts. She's also served as an executive director for a care management program in Indiana aged, blind, and disabled Medicaid population, as well as a member of the governor's cabinet focused on statewide policy programs. She's a proven business leader with amazing negotiation and communication project management skills. So welcome to the program, Amy. I'm so excited to have you here.
Thanks, Christopher. Great to be here. Thanks for that trip down memory lane of my background.
Yeah, you've been a busy woman. That's amazing. What a very impressive resume. And I know, that's the resume, right? And so, but that's not the story. And so I want to hear the story about Amy Brown and her journey in this industry and how you have arrived to what you're doing today. So if you would just take a few minutes and share with our audience Amy's story.
Sure. Thanks for that. So I think you're so right. A resume only gives some data points, but the story is much more non-linear.
Exactly.
Yeah. So, I'll start at my educational background. I went to school really passionate about human behavior and ended up getting my master's in social work.
Exactly.
And even though social work is often thought of as a field where you are engaging at an interpersonal level with, other people, mm-hmm. I was really passionate about more systemic issues. And so my studies were really focused on, systems of care and how those systems of care truly improved outcomes for people. And so in my experience in state government, which was at the earlier stages of my career, I started to really understand patterns and themes of issues that are affecting people. I worked in the child welfare area. I worked in Medicaid, as you mentioned, and started to notice, themes. After I left state government, I spent many years working in the private sector, but my role was always providing leadership to the front line of our teams. And the front line of our teams within healthcare were the folks who were talking every day to patients. Exactly. And to doctors and other healthcare consumers.
Those unsung heroes, right?
Yes, exactly. The unsung heroes. And what I learned still with that kind of systematic mind and passion of mine was that we were taking in the companies I worked for, millions of customer conversations and inquiries every year. And I learned a lot about what it means to listen to those voices and to listen at scale. And really that is what inspired the founding of Authentics. I didn't think about starting Authentics until I had already kind of hit my 40-year-old age mark. And there was something about hitting 40 that I called it my freedom 40s.
Sure.
I had already kind of like achieved the milestones that I had told myself meant success. And once I arrived at those things, I kind of realized that wasn't it for me. And I just kind of got to this stage where I wanted to marry my ideas and my passion for kind of listening at scale to populations with my readiness as a professional to go out and take a leap on my own.
Exactly. So was it about really following now the passions? I think, for me, as I went through my own career and I got to the C-suite, right? And I looked around and said, is this all it is? I mean, it's great. I'm very proud of the journey, but what was I doing things that were really a part of the passion? And then you hit those milestones in your life, right? 40, now me in my 50s, you start thinking about legacy, right? And you start thinking about what am I really, what's my real purpose in life? And am I really following those passions? And was that really what drove you at that also? Was it you hit that milestone and you said, I'm making a difference, but am I really following those things that I'm very passionate about? And that's what spurred it was a catalyst for really launching your entrepreneurial endeavors, or was there some other kind of major milestone? For me, it was also, hey, I had to transition from my previous job because my services were no longer needed and I needed to reinvent myself. And so I ended up launching my own company as well too. But I'm just curious from your perspective, what was that one thing that drove you to say, hey, I need to do my own thing here?
Yeah. There were really two key drivers that led to the leap of faith. The first was that, for several years, I was on an internal journey and was really trying to figure out who the authentic Amy is.
Right.
I think all of us start out in life and we start to pick up training data on what success means for us. And we're influenced by our culture, we're influenced by our family, our friends, and we're definitely influenced by the companies with which we, take steps in our early career. And I got to a stage of, I guess, taking a pause and having enough confidence to question whether or not all of those things that I had been doing and saying were successful were really things that I truly believed in. And so that introspection and that phase of introspection really allowed me to realize that an entrepreneurial endeavor was a big part of what I was supposed to be about in my life. And it was once I realized that and kind of looked at myself in the mirror as authentically as I could, it kind of became, well, what are you going to, now that you see it, you got to go do something about it.
Yeah, exactly.
Yeah. And then the second thing I'd say is, I'm a mom of 4 kids, and I think a lot of young parents are either taught explicitly or implicitly that part of their job is to make their kids' lives comfortable. And, that we kind of associate comfort with, we're doing a good job. Exactly. And I started questioning that. And I said, hey, look, I'm telling my kids every day that they need to follow their dreams and figure out what their passions are, and that they can be anything they want to be.
Exactly. Take a risk, take a chance, right?
Yes, take a chance, take a risk, learn, fail, and learn. And I started to realize that if I was not modeling that behavior of taking risks, that I was failing them as a parent, and that it was more important that I demonstrate risk-taking and the act of courage than it was about keeping their lives comfortable by mom being employed at a corporate gig. And so it was really those two things that led to the leap.
That's interesting. I'm also wondering too, the fact that you were very successful in your corporate career as a woman also, was that part of the influence of you also moving into wanting to control kind of your own destiny, running your own company? Tell me or share with us a little bit, if there are any anecdotal things you could share about that experience of being a woman in corporate America and specifically in the healthcare industry, and what were some of the interesting milestones or issues that influenced your decision to also take on more of an entrepreneurial role and be your own owner of your own company?
Sure. Yeah, I grew up in a corporate world, an environment where there were certainly women, but there were more men at the higher levels of the organization. And as I got promoted and increased in my scope of responsibility, the number of women that were my peers, continued to diminish in terms of volume. And so, I found, I think for a good part of my career, I was just trying to compete and win. And in order to do that, I studied the systems that had been created, and tried to be like them.
Right. And those systems were primarily driven and developed by men, right?
Exactly. They were systems developed by men and predominantly white men. And the first part of my career, I was just trying to learn those ropes and compete within those systems. And so part of my internal journey within that I mentioned was kind of understanding for myself what parts of that system did I accept and what parts of that system was I going to reject and that I needed to reject so I could do my own thing. And so, I learned a lot about, I guess, window dressing or clothes, if you will, as an analogy that I was putting on so that I win in that environment that no longer fit me anymore and that I was no longer willing to carry around.
Exactly.
And so really, that was a part of the liberation of starting my own business, was rewriting the systems that are governing, I guess, how we do our work and culture here.
Right. I know when we were prepping for this conversation, you shared a story, kind of around double standards and how if a woman reacts a certain way, it's seen in a certain perspective versus a man. And I was wondering if you would share with our listeners that story.
Yes, sure. Well, I'm known, those who know me well know that I like a good cuss word here and there. And it to me, it's an expression of passion about something. And so I was in a meeting a couple of years ago with a couple of attorneys and investors in Authentics in my business. And we were on a topic that, a problem we were all trying to solve. And I was becoming passionate about the topic and exerting my opinion. And I dropped an F-bomb in the conversation. And during that little segment of the conversation, one of the attorneys said, well, I guess we need to note that Amy's feeling awfully emotional today, and maybe we need to all calm down. And that did not help me calm down. Actually, it frustrated me because I know that if I were a man, that comment about emotion wouldn't have been made.
Versus passion, right?
Right, right. And then the second, after I had a couple of minutes to reflect on it, so what if I was being emotional? Why is there something wrong with that?
Right. That's good. And it's okay to be emotional about issues. We are human beings, right? And we need to sometimes bring that into the conversation, right?
That's right.
Yeah.
My mom always told me, use your anger and harness it for change, right?
Exactly.
And that's kind of what I was doing in that moment. So
Absolutely.
that's just an example.
That's great. And I think you shared with me also that you made sure that he understood going forward, right?
Yes, I let him know that I would not be tolerating commentary like that.
There you go. There you go. Absolutely. I completely agree. I think that, that's the beauty of having diversity in your leadership, in your teams, men, women, people of color, backgrounds, et cetera. We bring all our different perspectives and lenses to the discussion. And emotion is a good part, an important part of that discussion. And that doesn't diminish the value of the conversation or the context of your perspective as well, because you're showing how passionate you are about it.
That's absolutely
so please continue
correct.
to do that. I do want to pivot to what you're doing today, and really what are some of the things from your perspective you're very passionate about and that you're focused on trying to close the gap on. So maybe you can share a little bit about your company and the things that you're focused on today.
Sure. Well, I'll start at the cultural level and something
Sure.
I'm really passionate about, because it's not just about the problem we're specifically addressing in the market, it's the how we're solving it and the culture we've built around ourselves. I am super passionate about creating an environment and a culture where all people who work here can truly be who they are and bring their full self into it. And the business reason behind that is I believe that when we are truly authentic, we are safe to express our ideas and opinions. We are safe to disagree, and we are safe to interact with each other in a space that allows for mutual learning. And that will allow us to be a high performing company. Now, it's really trendy and popular to say, bring your full self and bring your authentic self to work. It's another thing to actually make that happen. So we are very intentional about working with all team members from the day they begin and throughout their tenure here, of kind of peeling back the onion and creating a space of exploration. I think all of us, myself included, come into an environment like ours with all kinds of baggage of things we've told ourselves we have to be. And one thing I'm learning a lot about is that for people of color, for people who don't necessarily represent the mainstream, that challenge of being okay to be who your authentic self is in a corporate environment is even bigger than those who do fit the mainstream. And so learning how to intentionally create that space for all of us is really critically important. And we work hard at that every day.
That's great. And so talk to me a little bit about then, obviously you're creating a great environment that allows people to your point, be their authentic self, bring their real value system to the conversation. How are you now directing that towards those initiatives that your organization and you personally are really focused on today?
Yeah, so our work is all about helping healthcare organizations, and think about these as really large enterprise organizations. So think about big insurance companies, pharmaceutical companies, pharmacies, those types of companies. We're trying to help the leaders and the folks that are responsible for caring for their customers. We're trying to help them listen at scale more effectively to the customers they serve, and to drive change based on the empathy that they gain through that listening process. And
why is that important?
Well, it's important because if we don't have a true understanding of the patient population that we're serving, then we're not going to devise policies that actually improve health outcomes, improve the quality of care, the cost of care. And everybody says they want to improve outcomes and the quality of care and the cost of care, but they don't know how to get there. And what we're saying is, well, the starting place and the foundation is you have to first listen to understand. And that's a big deal for gigantic companies that handle tens of millions of customer conversations every year. And so what we do is we combine artificial intelligence with human expertise to really help these large healthcare companies truly understand their customer in a way that it impacts them in not only kind of cognitively and through their cognitive brain, but kind of they understand it experientially by essentially we serve up a way for them to walk a mile in their own customer's shoes by creating this immersive experience for them to understand their customer perspective.
Right. It almost seems intuitive that, listening to the voice of the customer, right, in order to make decisions and understand what their needs and challenges are should be a part, how an organization frames its business model and offers services to the consumers that they serve. But to your point, it doesn't appear that in many cases, the large, whether the providers or payers or other parts of our ecosystem really have embraced that in the past. And so your services and your solutions that you are offering create or help to facilitate aggregating this information and then providing business intelligence to the customers that you serve to understand the emotional impact and the personal impact on the patient itself. And shake your head yes or no if I'm not going in the right direction.
You got it.
Okay, that's great. So tell me, in terms of again, you've had an interesting journey in this space, and you understand where we are in the evolution of healthcare and how technology is impacting that. What are some of the major issues that are facing healthcare today as it relates to creating a more holistic delivery of care? And obviously your technology, first of all, is listening to the customer clearly. That's one, or the patient. That's one thing. But what are some of the other things that, from your perspective, we need to be focused on as industry leaders?
Well, in the United States, there was recently a study by the Commonwealth Fund where it was comparing the United States against the 10 most wealthy countries in the world. And they were comparing the United States with those countries around several criteria, being, to name a few, health outcomes, cost of care, and access to care.
Right.
And in all three of those categories I just named, the United States was at the rock bottom and compared to all the other wealthy countries. And these were not all countries, by the way, that have just a single payer system. Sure. Many of those countries had, like we do, multiple insurance companies and different providers.
Private payer system.
That's right. And so that should tell us that we have a very broken system. Right. And so some of the things I can tell you that are our biggest challenges, just from listening to millions of customer conversations at this point, is, first of all, the business of navigating healthcare for consumers is so incredibly difficult and complex that navigation of trying to wade through the complexity of our system is almost as critical and crisis-like as the healthcare
delivery
concerns themselves, right? Exactly. Because we have people who delay getting care or don't get care at all just because of the complexity of trying to cross through all the hoops.
Right.
And what that points to is a massive disconnect between the key stakeholder industries within our healthcare system. So, payers, providers, pharmacy, those three verticals alone, those three subsectors alone have so much kind of mismatch between them that it just creates an incredible amount of work, cost, complexity for all of us. And we're all paying for it.
Absolutely. A lot of conflicting priorities and a very dysfunctional delivery system as well. And that being said, any thoughts or, suggestions to, leaders within those three major pillars that can help to really close the gap and reduce some of that frustration and anxiety that patients and even us, those of us who are in healthcare, still struggle with navigating the healthcare system as well, too. And so I'm just curious, from your perspective, Are there some things we can focus on to start to close the gap? Obviously, Rome wasn't built in a day, but we can start making some incremental improvements here. And just any thoughts around that?
Yeah. I think we've gotten good as a healthcare industry on leveraging our structured data. So looking at claims data, lab data, and at least understanding patterns or themes associated with disease and comorbidities and that kind of thing. But in order to really drive improved health outcomes, you have to understand not just the clinical data.
Right.
You also have to understand the social, environmental aspects of humans' lives,
Exactly.
because those impact behaviors associated with healthcare. And
Absolutely.
I think that's where the problem we're trying to focus on is leveraging unstructured data, those conversations,
Sure.
it's a vast array of data that helps shine a light on those things. And once leaders can understand both the structured and unstructured data and they see it as a whole, they can start to solve problems with a much greater depth of understanding. And we've seen leaders like within their own organizations start to reduce complexity of their systems and their processes because they now have a much better understanding of how customers are being impacted and how their bottom line is being impacted by this complexity. And they've done that through creating this listening program. So that's what I would say to start with. And I know it sounds like a very a plug for Authentics, but start by understanding and listening to your customers in a much more data-driven way, so that you get that other side of the story.
Absolutely. And definitely a much more holistic approach to it as well, too. It's not just about the quantitative data that they're collecting, but also the qualitative data and information that you're in the feedback that you're getting from the customer that helps to create a more holistic approach to the delivery of care. And again, to reduce some of the complexities associated with navigating the healthcare system. And by doing that, hopefully, patients are more willing to now get care, early on in the process before it becomes much more severe. Hopefully providers are much more aware of what those challenges and issues and concerns are with patients. And so they're more sensitive to how they communicate and collaborate with the patient. And then hopefully, the business leaders, those that are sitting in the ivory towers, recognize that, they can achieve the goals that they want financially and for their shareholders, as well as being socially responsible about how to deliver it as well.
Exactly.
Well, good. So I want to, again, pivot just a little bit. We've got about 5 minutes here before we'll have to wrap up. Again, I'd love to have you back and drill down even further into some of these topics. But just general advice or perspective you can give as an individual who was very successful as a corporate leader and then now very successful as an entrepreneur. For those who may be sitting behind their desk now at lunch, in their office, contemplating, hey, I got this great idea and I want to go and make this a reality and start my own business. What's some words of wisdom you could share with those folks who are a little have that anxiety, but yet that passion burning to make a difference and control their own destiny?
Yeah. Well, first of all, I would say listen to the voice. If you are sensing a conversation with yourself about an idea or a passion, don't squelch it, listen to it. Christopher mentioned in the opening here about a baby product that I invented, and I'm going to use that as the prototype, if you will, or the analogy for the advice I would give. I had an idea that came to me as a young mom, first child, and was trying to figure out how to properly label my bottles for my baby when I was dropping my child off and at the childcare. And I first did a search for my idea on Google to see if anything the idea that I had was already created, and I didn't see it exactly what I was looking for. So I started to write down that idea, right? I started to create kind of a journal, if you will, of what I was trying to solve. And so the first piece of advice I would give is listen to the voice and start writing down what you're hearing and the ideas you have around it. From there, I created a prototype of this labeling solution. And the way I created it is I literally got pieces of paper and I used tape and I used scissors, and I started creating a prototype.
Oh, interesting.
So I would advise those of you who have an idea to start trying it on. Like, what would it look like, feel like? What's a really scrappy version of that idea? And start to put it together.
Sure, that minimally viable product, right? What does that look like?
That's right. And even if it's not viable yet, like what would it look like if it were viable? What's the very smallest thing it needs to do? And it's like this exercise of trying the idea on, like it's an article of clothing. And then as you go through that process and consider it like a side hustle hobby at this point, once you've got it somewhere, start to socialize it with your friends and family. And what I have found is the process of giving that idea time and space helps you so much. First of all, learn about yourself.
Sure.
Second of all, determine whether or not the idea is worth pursuing, whether you have enough passion behind it to actually turn it into something that you're willing to leave your job for. But the journey in and of itself is a worthwhile one, even if at the end of the day, the answer you come to is, this is either not the time or the idea that I'm going to make that leap for. It's a really great experience and self-discovery to pursue that idea.
No, that's great. Great advice. It's all about appreciating the journey and not the destination, right? And that's where you grow as an individual. Well, we're coming to the end of this session of Straight Outta Health IT. I want to thank Amy Brown for taking time out of her incredibly busy schedule to have a chat with me and those of you that are listening, to share her journey and her passion and what she's focused on now with her new role as CEO of Authentics, and how she is continuing to make a huge impact on our community, our industry, and the world in general. So thank you so much, Amy, for your leadership, your vision, your passion. Continue to be uncompromising in those things. We need more people like you helping us change the world.
Thanks so much, Christopher. I've really appreciated the conversation.
You're very welcome. And thank you, everyone, for continuing to support this program. As always, your comments and feedback are welcomed. You can find us on all the major streaming platforms. So please continue to listen, share this episode. Let's make it go viral. And we'll see you next time. Take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.